Hey everybody, how you doing? This is Dr. Wise coming at you from the Wise Center for Plastic Surgery. I wanted to talk a little bit today about the deep plane facelift. I've been getting quite a bit of chatter on our social media sites and also, consults in the office about, what's a deep plane facelift? There's a lot of other techniques out there. Which one do I perform? What do I think is the best? Who's a candidate, and so on. So hopefully we can clear a little bit up here today and actually show you some real patients in our office that maybe would help kind of elucidate what it's all about. Who's a good candidate for a deep plane facelift? And it's really pretty simple. It's usually someone who has experienced a bit of a kind of a tired look. People often complain that they have some jowling in their face area. They have a little bit of laxity underneath the chin area. Their jawline isn't as sharp as it once was. And they just want to seek improvement. They want to look fresher, more rested, and they want to look younger. There's three things that are absolutely critical to any facelift, and that is you want natural results. You want to look great and awesome and all that good stuff, but you also want to look refreshed and, most importantly, not operated on. So we want to be a secret. We want people to say, "Oh man, you look great. Did you lose weight or did you change your hairstyle or something, but you look fantastic, you went on vacation." So we want people to say you look great, but not to really identify it as an operated look. And we don't want people to look fake. We also want people to be able to recover from this as quickly as possible. So a deep plane facelift in my hands usually requires about 10 to 14 days of downtime. Usually by 10 to 14 days, people can go out with their friends. They can, have a meal at a restaurant and so on, and everything would be absolutely fine. And the third thing that's critically important for a facelift, particularly a deep plane facelift in my hands, is we want it to be long lasting. Unlike fillers or Botox or other facelift techniques, a good facelift should last anywhere from 10, 15, 20 years. Let me just give you an example of a patient. This is obviously her preoperative photos. She came to us, she's about 68 years old, and she complained of, hey, my face is feeling a little bit long, a little bit droopy. She complained of having some jowls. She didn't like her cervical mental angle, meaning the angle between her chin and her neck. She thought there's a lot of excess there, and she wanted a more contoured jawline and neck area. In addition to that, she's originally from the South, and she had quite a bit of sun damage on her face, and she was seeking correction of that issue as well. And then finally, she complained that her face was a little bit hollow. Over the years, as many of you know, we lose a little bit of volume in our face, and there are things that we can do to restore lost volume. So this is really kind of our sweet spot. She's a great candidate for a deep plane facelift. What is a deep plane facelift? How is it different than other facelifts? A deep plane facelift really distinguishes itself from other facelifts in the sense that we go to the deepest layer of the face that's safe. So as many of you know, there's skin on the outside of the face, of course. Underneath the skin is a fascial layer, and that fascial layer is known as the SMAS. And the SMAS is an acronym. It stands for submuscular aponeurotic system, which is a mouthful, but basically it's the fascial layer that connects the face and gives the face structure. So in broad strokes, let me discuss a little bit about how we perform a deep plane facelift and what separates it from other procedures. So the first step of a deep plane facelift is typically something we call a platysmoplasty. So everyone has a platysma muscle. That muscle is a sheet-like muscle that encompasses the entire neck and also the lower 1/3 of the face. That muscle is very critical in its function, in the sense it's really a structural muscle. It doesn't really do a lot functionally, but it does provide structure to the neck and the face. As we get older, the muscle becomes a little flimsy and laxed, and oftentimes it actually separates in the middle. And this is called platysmal diastasis, or separation. And a platysmoplasty is a procedure whereby we make a little incision in the middle of the chin here. It's underneath, so it's hidden very nicely. And we actually put the muscle back together again. And so that corset, or that platysma muscle, or platysmoplasty rather, really fixes the muscle and makes it nice and tight. The second aspect of the procedure is when we turn to the lateral or the side portion of the face. We make tiny little inconspicuous incisions in the inside of the ear. I do a retrotragal approach, meaning that we actually, instead of making an incision on the front of the face here, we actually go inside the ear to hide it. So it's very inconspicuous as far as any signs of any scarring or anything like that. People don't really see that. When we do a deep plane facelift, we actually lift up some of the skin from the side here, and this is the skin elevation. That gives us access to the deep plane. The deep plane of the facelift is actually the part that happens right here. And what we do is we actually go underneath that SMAS layer that we had discussed into the deep plane. So that's right above the muscles of the face and the structural support of the face. So we actually isolate the SMAS layer. We go underneath that. And this is the area where we actually go underneath all that. And as you can see, this area is closer to the central part of the face, which actually allows us to get the best pull. So that gives us the most natural result, but also the biggest pull and the most impactful result. So as we discussed, this is a 68-year-old woman. She was dissatisfied with the appearance of her face. Specifically, she didn't like the jowling, the neck laxity, sun damage. She thought that she had some volume issues in her face as well, where she looked a little bit hollow in certain areas. And what we're about to show you is 8 weeks following a deep plane facelift, a CO2 laser, and autologous fat transfer. Fat transfer is a process by which we take fat from the abdomen, we process the cells, and we inject it into certain areas of the face that are volumetrically depleted. So it gives you restored volume and increased texture to the tissue. This is our patient at 8 weeks. You can tell she's obviously a very, very dramatic change in her jawline. It's essentially razor straight, and her neck laxity here has been essentially completely eliminated. You can see that the sunspots on her face have been eliminated by the CO2 laser. And also she just has some nice volume in her temples, her cheeks, around her mouth, and that's from the fat transfer. This is a view of her from the front. The most important thing for a facelift, she looks like herself, but she looks great. These results are very long lasting, and she was back on her feet in approximately 2 weeks. So obviously very, very happy patient. And over time, this facelift continues to get better and better. So this is only at the 2-month mark, but as time passes, it'll feel more natural for her, it'll feel better, and she'll even look better. So this is our 68-year-old patient. Let me show you another example. This is a 52-year-old woman. Her name is Diane. She actually works in our office. She's my patient care coordinator. Many of you have met her or will meet her. She's terrific. But Diane was dissatisfied with her jawline. She thought she has a neck laxity. This is Diane from the profile view. And this is Diane about 6 weeks after her deep plane facelift. You can see she's looks like herself, eyes, nose, mouth, the same. But you can see that her jawline now is quite straight. She's got a really, really beautiful neck contour. And she was super, super happy. And she was back to work at our office within a few days. Now that's obviously someone who works at my office, but she was really feeling pretty good in a pretty short amount of time. This is Diane from the front view, and this is Diane after her deep plane facelift. Still looks like her, nothing's changed. Her essence is still the same. No one would say, oh my God, you know, what happened to that lady? But she's got a really nice jawline and neck, and all these wrinkles in her neck and facial area have been completely eliminated. The final example, this is a 49-year-old woman. Very, very pretty. She just had some issues with her face that she was dissatisfied with. Specifically, she thought that her chin was a little bit small. She didn't like the fact that she had a lot of crowding around her mouth. She had some jawline issues where she thought her jawline looked a bit muddled. She also didn't like the fact that she had some neck laxity as well. In addition, she also thought that her face was a bit long. She had lost some volume in her 30s and 40s that she wanted restored. We did a deep plane facelift. We did autologous fat transfer, where we put fat, as we discussed, in areas of her face that seemed volumetrically depleted. And then finally, to enhance her jawline, we gave her a chin implant. So let me show you her afters. So this is her approximately 8 weeks later. And you can see, I mean, it's a huge improvement. You can see that she's got more volume in her face. You can see that her chin obviously has a more balanced projection. When we talk about chin implants, we just want a little more harmony in the relationship between her forehead, her nose, and her chin. We're not trying to give some big, like kind of Jay Leno like chin. We're not into doing that. We just want people to have a little more definition. So that's her result. And obviously with her deep plane facelift, you can see she's really got just a beautiful silhouette here, and she's super happy. This is her frontal view. Obviously she's wearing a little bit of makeup in her afters, just for full disclosure, but you can see the general contour of her face. got a really, really nice looking jawline. Her neck is really, really strong and blemishless. And then of course, she's got a little extra volume in her face area here, and her cheeks, around her mouth, and her chin just is a little bit stronger, so it provides a little more strength to the face. All right, guys, thanks so much for listening. This has been our discussion about the deep plane facelift here at the Y Center for Plastic Surgery. I invite you to reach out to us via email or social media, or give us a call. And I can't wait to see you guys.